Hello everyone. It is unbelievable that bacteria that is a reason for simple strep throat in one person can cause necrotizing fasciitis, a life-threatening flesh-eating disease in someone else. This disease is caused by a superbug known as Streptococcus pyogenes or group A Streptococcus. This is a rare disease that destroys the tissue and underlying skin, which then leads to complications like toxic shock syndrome, multiple organ failure, and even death. Group A Streptococcus is commonly residing bacterium in our throats, but due to our overuse of antibiotic, it has mutated into this horrifying flesh-eating disease. Today I'm going to talk to you and inform you about how this superbug enters our body and how to recognize the signs and symptoms of necrotizing fasciitis. I'm also going to explain to you how this bacteria has developed resistance to antibiotics due to overuse of antibiotics. Finally, we're going to talk about why this bacterium, which is commonly residing in our throat, has become so lethal. As this bacteria have become resistant and cannot be treated with commonly found antibiotics, proper diagnosis is necessary for the treatment and cure of an infected person. The germ usually enters our body from the skin where there is a deep tissue wound or surgery. There have also been many incidences where the infection has spread through minor scrapes or even through pimples. Also, until recently, this infection was associated with the hospital, but now more and more cases of community-acquired infections has been noted. Since this germ can attack anyone in any setting, it is crucial to be aware of early signs and symptoms associated with infection. Early signs include out of proportion pain compared to the size of the wound and red, shiny skin around the wound. Soon after, the skin around the wound starts turning bluish purple and blisters containing yellow fluid start to appear. Symptoms get worse quickly. Under the skin, the bacteria multiplies rapidly and destroys the underlying tissue. As the tissue is destroyed, gas starts accumulating under the skin, producing a vicious odor. Toxins in the body increase and the person develops high fever. All of the soft tissue then turns into a watery, foul-smelling fluid, and infection starts to enter our bloodstream. By this time, the nerves under the skin are dead and numbness is replaced by pain. The toxins attacks the body's immune system and turns it against itself. With a weakened immune system, the body cannot fight for itself, and complications like multiple organ failure ultimately engulf a person. Until the last few decades, this super bug could be treated with antibiotics, but over the years it has evolved, and these drugs are no longer effective. Also, these kinds of infections were restricted to hospitals, but now they're becoming more and more community associated and are known as methicillin-resistant Streptococcus aureus infections or MRSA infections. So how does a microbe that was resistant to drug or antibiotic become so lethal suddenly? Most medical professionals blame this to newly developed resistance over time to misuse of antibiotics. Bauman explains in his book Microbiology with Disease by Taxonomy that pathogens develop partial or complete resistance to drugs. He says that in the absence of drugs, the resistant cells are less efficient than the non-resistant cells. But when antibiotics are introduced, the non-resistant cells die while the resistant cells thrive and multiply. Now the newly evolved bacterium spreads its resistant genes to other generations, producing more and more resistant species. In the article Fighting Superbugs by Marsha Clement, he has tried to warn us against this misuse of antibiotics too. He explains that an antibiotic is designed to kill specific bacteria, but they can mutate and become resistant to these drugs. Over time, such antibiotic-resistant bacteria can survive and multiply, producing an entire population of resistant drug that is difficult to kill even with the existing antibiotics. He also says that the antibiotic is like a tank of gasoline. So when it runs out, it runs out. The only thing remaining to do is develop some new ones. Streptococcus pyogenes have been residing in our throats without being harmful. But now this bacteria has mutated and taken a deadlier form that attacks our immune system. So why has the commonly found strep suddenly become so lethal? In the article Flesh-Eating Bacteria, Not New But Worrisome, the author Nowak explains to us that this common bacteria has now mutated and produces two different kinds of deadly toxins which work against our immune system. He says that the reason why this disease is uncommon is because most of us are immune to it. Therefore, individuals with a weaker immune system are the ones who are more susceptible to these infections. Novak wants us to be cautious as these diseases can spread quickly and become very deadly. As this infection is no longer restricted to the hospitals and has spread to the community, it has become necessary to educate the society about preventions and treatment related to this infection. There are some things that you can do to avoid falling prey to this deadly disease. Do not neglect any minor scrapes or cuts. Make sure you clean them thoroughly and watch for any spreading infections. Minor redness or swelling is normal, but when it does not go away, it's time to go to the doctor. Make sure when you're given a course of antibiotic, finish it and complete it as directed by your doctor. Do not ask for any antibiotics from your doctor for common illnesses like colds and coughs. Maintain a healthy immune system. Although reports in the news have increased our awareness of this condition, the number of persons affected with this disease has not changed since the last several years. This infection only affects about 3 to 7% in a million in a year. Once infected, though, a perfectly healthy person can literally be reduced to bones within days. The horror caused by necrotizing fasciitis is evident in patients suffering from the flesh-eating disease. Therefore, making it to the hospital in time can be the most important step in your recovery if you happen to catch this horrifying flesh-eating disease. Thank you.